we move on to the next panel discussion, which looks at precautions of the use of cannabis sativa in medicine. And we have two speakers who will address that. The first speaker will be Dr. Anthony Hall, neurosurgeon, Rastafari neurosurgeon out of South Florida, also based here in Jamaica. And Dr. Anthony Hall is the CEO of Pure Jamaica Island Traders Limited, which is right now the first and only approved Rastafari-orientated company that can legally dispense marijuana in terms of as a medical dispensary. So Dr. Hall can speak to what this Pure Jamaica is doing presently, and also the issue of precautions that need to be taken so far as the use of cannabis sativa in medicine generally. So Dr. Hall, I don't know if everything is connected and everything. No. While we're doing the technical necessities, you can probably give an intro to the topic. Yeah? Preamble.
Greetings in the name of His Imperial Majesty. That's the first. So I apologize, no PowerPoint. I'm going to have to do like Dr. Pottinger did, read the slides. So it will be a little simpler than what I had planned before. So my name is Anthony Hall. I'm a neurological surgeon. I'm also connected with Apollon Medical Formularies here in Negril. I'm Chief Medical Officer, and Pure Jamaica Island Traders, where I'm the president. And we are interested in the medical aspects of cannabis and how that can be used to treat disease. So, how many of you were here yesterday when Dr. Michelle Emmanuel spoke? Only a few. Okay. Well, I must tell you folks, you missed the most amazing lecture from Dr. Emmanuel. So I'm just going to touch on a few points he made just so we're all up to speed. And those of you who were here earlier with Dr. Pottinger, there was some discussion on endocannabinoids. As you know, this is an educational symposium, but it is 3 days long, so you have to come every day to catch everything. So we're talking about the genus cannabis and the species sativa. Now, this plant, I won't repeat everything Dr. Emmanuel said, but the plant is an annual herbaceous flowering plant, okay? The flowers of cannabis sativa are unisexual, and the plants are either male or female, just some basic points. And genetic factors can predispose a plant to be male or female, but we can alter it in the environment. Now, this plant contains about 500 known compounds. About 113 of them are the cannabinoids, and the other ones are the terpenes and what we call the sesquiterpenes. And those are involved with a lot of medical aspects of as well. Now, I'm going to just use a term, chemotaxonomy, which could come back to a previous gentleman's question of Dr. Pottinger for the differentiation, but there are 5 chemotaxonomic groups of cannabis sativa. So the first one is that high THC strain, which can be either forma indica or forma sativa, or you can make hybrids. The second one that we know and we commonly call hemp is a high CBD fibrous strain, and you can make all kind of things, like some nice clothes you can buy over there made from it. You have some intermediate strains, which are mostly the cannabis ruderalis strains, and Dr. Emmanuel spoke about that yesterday, and so I don't want to go back in that. Then you have some high CBG cannabigerol strains, and then you have also a class 5, which is almost totally lacking in cannabinoids and also good for industry and clothing as well. So sativa and indica strains really differ in the concentration of the cannabinoids, the concentration of the terpenes, and you can see many other differences in the plant. So I'm not a grower. Check one of the growers and it can give you more details. Now, to understand the medicine, as Dr. Pottinger spoke earlier, you have to understand what we call the receptors. So he mentioned that there are at least 3 or 4 different receptors. The main 2 we talk about are CB1. Now THC, everybody knows that, it acts on the CB1 receptor, as he pointed out, a partial agonist. So that means partially it positively actuates it. Now CBD acts on the CB2 receptor as an agonist, but it is also antagonist partially to the CB1 receptor. And that's the key point of this talk, that CBD partially is antagonistic to THC. And there are other receptors like TRLV1, GPR55, CB3, there are many more. This plant is powerful, and our human body's ability to receive it is powerful. So, on average, just simplifying, cannabis indica strains have lower THC compared to CBD, and cannabis sativa strains have higher THC to CBD ratios. But you have a huge variability, and there are thousands of strains, so you have to look it up. Now, CBD also acts on another receptor that I have to just medically introduce. This is called the serotonin receptor, or 5-HT1A receptor. And on that receptor, it's an agonist. Now, this receptor is the most crucial receptor in psychological balance and function. That's what all the drugs like Prozac and the like are targeting, okay? So, if you have a strain that has CBD to a THC ratio, anything above, like say 5 to 2, that's gonna give a person more of a relaxing feel and causes less anxiety. So, I touched on the word anxiety, and why are we talking about it? Even I'm coming right after National Council of Drug Abuse, but so be it. But cannabis does have some side effects, and it does have some adverse effects. That doesn't mean we throw it away. We didn't throw away metformin to treat diabetes because there are 50 or 60 side effects with metformin. We haven't thrown away Depomedrol to treat joint tears, even though there are over 100 side effects from that drug. So let's talk about this medicine, because this is a medical talk, right? I think this is the medical panel. So we're going to talk about cannabis withdrawal symptoms, and it can be explained by the receptor. So it's not a common finding, but it does occur, and it has been seen. You might have seen someone with cannabis withdrawal, but you may not have recognized it. It produces things like irritability, nervousness, sleep difficulty, decreased appetite, restlessness, a depressed mood. Sometimes they can have cramps, diarrhea, vomiting. And you might think, well, maybe they're just sick, or maybe they just need more herb. Well, actually, both are true, and they need more herb because they're going through a little withdrawal, and that's cannabis withdrawal symptom. So some of these same symptoms come from interaction and adversity, especially from a low CBD THC ratio strain. And it really is because this ratio is going to mitigate what the serotonin receptor activity was trying to do. So what is it that allows the CBD, the THC, to really interact with this 5-HT1A, the serotonin receptor? It's because the CB1 receptor is a very complex receptor in the body. So receptors, you have to think of them as a big fat ball, and it's on your tissues, located on different organs, and this CB1 receptor can actually integrate other receptors and join up to other receptors on the tissues that it's located. So if the THC comes in and joins on that receptor, it might alter what serotonin was supposed to do on the backside of the receptor, so to speak, and that might change your mood. So that's one explanation. Another explanation has been shown, and there's a lot of research, but we won't list it all, is that cannabinoids also interact at the opioid receptors. So we know that playing off, right? Because if you're in pain and you were taking opiates, that stop the pain. But you can take cannabis and stop the pain also. So it wasn't because the cannabis worked at a different receptor, it worked at the same opioid receptor. So that might also interact, because when you take opioids or you withdraw from them, you have some of these same symptoms. So we all know some common sativa strains and varieties, and what I want to just point out is, and we'll do some case examples, and this will be the easiest way since we don't have the slides. Let me just get to the case examples. First one I want to take is a 52-year-old female with no prior history of mental illness. She using cannabis for foot pain and relaxation. Comes to Jamaica and tries a Westmoreland-grown sativa and develops acute paranoia, accusatory behavior, stomach cramps and vomiting. Sees a naturopathic physician, treats with soursop juice, and changed to an indica strain with total resolution of the thoughts and the gastrointestinal symptoms as well. And I want to throw this out to the audience. What you guys think? What was happening with that patient?
The herb worked.
Which herb though? The indica worked. So the sativa strains have been known to trigger anxiety attacks, paranoid behavior, stomach cramps, diarrhea, vomiting. And which part of the world grows the strongest sativa forma? No, Westmoreland.
Really?
Yeah. So from Westmoreland is the strongest cannabis sativa forma sativa type of strains known. And so someone might just come down and they say, okay, let me just try some Westmoreland ganja, but come here, say good. And they try and they're sick right after that. Okay, let's take case number 2. So now I have a 42-year-old male with a history of sickle cell disease. Everybody knows that? Sickle cell disease, yes. Who has lumbar disc herniations after a motor vehicle accident. So he wants the lumbar surgery. So he gets a lumbar surgery and also a stem cell transplant. So he's using some post-operative narcotics, but he wants to switch to medical cannabis for the pain. So he goes, this patient in Florida actually, so he goes and buys a sativa dominant vape. Because in Florida you can't buy a smoke flower, but you can buy vapes. So he buys a sativa dominant vape and he develops some behavioral changes, confused conversations, starts calling people at different times of the night, and he says his pain is not completely controlled. So he comes to the office. So what do you think? Anybody?
You add the CBD. You gotta increase the CBD and decrease the THC.
There's a person over there with the right answer. We gotta increase the CBD, lower the THC. One common way to do that, an easy way, get him off the sativa dominant strain, put him either on straight CBD or an indica dominant strain or a hybrid strain with a better ratio, higher CBD and lower THC. So we switched that, we actually changed him to an indica totally, and next thing you know, he's behaving properly, no more confused conversations, and his pain is controlled. Let me take case 3. It's a 45-year-old male. I hope you guys don't mind that it's all medical, but that's what we're talking about, right? Medical cannabis. 45-year-old male with a history of hypertension and a motor vehicle accident again. He has lumbar herniations. I'm a neurosurgeon, so most of the patients I see have herniations, okay? And he uses some local cannabis that he buys in Florida, but he doesn't know the strain. So he gets some behavioral changes and aggression. His mother calls the office because she's a patient also, and she wants to report changes in her son. Can we do something about it? So we bring him into the office and we switch him around. We actually had to switch him to a short-term narcotic and then an indica dominant strain. Next thing, the behavior changes go away, the pain is controlled, and he's functioning better. His mom is happy. She's using cannabis for a different thing, but she thought maybe she could give him some of her cannabis. I'm treating her for epilepsy, medication-resistant epilepsy. it's very good to use a high CBD, high THC strain in epilepsy. It's not necessarily good for pain in her son, because he probably had a pre-existing history of some anxiety, bipolar disorder, schizophrenia, something like that. You have to be cognizant of the ratio of the CBD to the THC to it. So I'm not coming to, throw rain on the parade or anything like that, but I just want everyone to know that this is medicine. You should treat it as medicine. This plant is powerful over thousands of years. The research is ongoing. The labs, there's another laboratory biochemist coming up soon. The labs are working on all types of analysis. When we get our cannabis to treat the patient, we need the spectrophotometry, we need the analysis, we need to see what's in it, we need to see the ratio, we need to know how many milligrams of THC, CBD, CBN, CBG are in each milliliter of the oil. Because otherwise, we could be treating the wrong thing. I'm not gonna give like my 3-year-old patient with a brain tumor the same cannabis as I give a 45-year-old with a history of anxiety and maybe some post-traumatic stress disorder, like a military person. They get different cannabis. Just like a person with high blood pressure who has kidney disease is going to get a different medication from a person with high blood pressure due to peripheral vascular disease. It's different. So, moderator, Dr. Barnett, no PowerPoint, so we can just do questions.
All right, we'll take a few questions and then have the next speaker come on. Dr. Pottinger has his hand raised. Anybody else?
Dr. Hall, thank you very much. Really nice and precise and short. I openly asking you to come to Trinidad for our rally on the 27th of January, because I am tired of getting abused from a Rastafari brethren when you try to make them know so well and stop telling people that this thing don't have no side effect or downside to it. Because every time you say that, man, I tell you about is the healing of the nation and rah, rah, rah. Right? So, I'd like you to come and say the same thing what you just said and give the same examples, and I keep my mouth shut.
Chris Fagan and then Raymond. Yes. Start.
Rastafari. You know, say I don't really have much to say because I know please. So I talk first night. Say School of Vision, as you know, is one of the vibrant and active members in the Rastafari communities. And when we hear of the Maroons getting the pilot plan, we heard also of Orange Hill, and we were told that School of Vision would be right in the tripartite, which means be added to the Maroons and the Orange Hill. What I'm not pleased about is, and I'm speaking on behalf of my society, we are getting the runaround. Runaround means to me that neither the Maroons nor Orange Hill is a proper representation for Rastafari. What do I mean Rastafari? It is the Rastafaris that have been prosecuted. It is the Rastafari that have been in prison. It is the Rastafari that have died for the same danger that is in discussion here today. Now, I don't have the ability to even relate to some of the words and things that I'm hearing today. The CBDs, the THC, the cannabis, and some big words and some little intricacies which I know have the qualification for even argued about. But when I hear the doctor now going to speak about our position then where ganja is concerned, no, we still stand say, Rastafari say the herb is the healing of the nation. And why do we say so? If it is not so, how is it now that the same people that criticize and condemn I and I for using the herb now I give you all them big speeches and the profitabilities and the benefits and the economical advantage. Man, I said turn down lightning Rastafari. It's not right. It's not right. It's not right. Because first of all, I have said, and I now leave down the maroon because everybody don't know already the maroon position. And I have said 4 years ago that the maroon are the only free people in Jamaica. And it's not the Maroons as a society that have borne the prosecution. It is I, the Rasta. So why was I prosecuted? Because we say His Imperial Majesty Haile Selassie is God Almighty. And because we also say that the herb is not a detriment but a benefit. And that is why Canada today, I may the Almighty God bless the people in Canada and the country who have seen the need and the necessity to free up the herb that the people not only can be benefited medicinally, but also economical, and that is why we say we Rastas, we come out now and we feel demonstrate against the Labour government, because I am a Labour right, and I is not a PNP. Yeah, because some things are covered up here now, because remember who bring me down here, remember how long we have been down here, and we see where we are now and how it works. So we want them to just know, so when we say free the herb, if you free the herb and put away the hypocrisy.
Yes, Priest Fagan, 2 points that we raised. One is a general one that I think can be discussed later, the one about the lack of inclusion, you say, of Rastafari in the pilot program. I think maybe Rastafari can speak to that later, but the one that pertains to this panel now, I would like Dr. Hall to address it, the issue of her being a healing of the nation.
Mike, before you go, could I say something before it comes? I want to add on for your
Let's have a little order now. Let him talk and then I'm going to give you the mic. Yeah, please.
Bless, greetings, Rastafari. As you know, and I mentioned briefly in the talk, this cannabis plant has so many compounds within it, at least 500 compounds. I am pleased when I meet students who take an approach that they're going to go into biochemistry, microbiology, agricultural sciences, and they want to study ganja, because there's so much study to come out of ganja. I know scientists in our universities who do a 40-year career on just one product, and this is a plant with 500 compounds within it. So to me, student upon student upon student can study this plant, and before the big pharmaceutical companies jump into it, because right now Novartis, Bristol Myers Squibb, and even Walmart, they each own at least 300, maybe 500 acres of ganja farms that they are farming right now, and they're analyzing and they're looking for the products because they want to make pills. They want to make ganja pills. So we need to step up, we need to move forward, talk about the plant, study the plant, because there's so much that can be treated with ganja. Right now we treat maybe about 116 diseases, different diseases, epilepsy, cancer, autism, all this. But there are probably at least another 50 or 60 more we can treat if we know more about the plant, more about what's in the plant, and more about what it can do and the products within it, and specialize the strains, the medicine, and the prescription. So the doctors need an education too. And this is a good seminar. There's another one coming up in April at UWI. There's another one coming up in June at UWI. So you can get more information at the red table back there, as Jadogi, and read more. I encourage people to read. Don't let anyone tell you that there's no information on ganja published in the scientific literature. There are well over 15,000 articles right now published on ganja in the scientific literature. Most of them are chemical, most of them biochemistry, but many of them are medical, and they come from all over the world, including a few from this country.
All right, thank you, Dr. Hall. Rowan?
What I was going to say before you speak was that I am the needs to get you into a consultancy. Because when I sat here and hear you talk about the indica and the CBD, the indica clearly works. And anybody with money, here's you, and the investor, here's you, don't want to sign you up. Because what Dr. Pottinger is saying, you are saying something different than what I think he's saying. Because yes, for every medicine, there's adverse effects. For every medicine, so there's a danger. So for our Rastafari people, some if oversmoking, there's some bad habits. But for you, IFB should have let you leave today. You don't even have a contract that you become the council. Because what's very clear, let me say this. I am working with the government to do 1,000 acres of medical marijuana in Elizabeth. And there's a school of thought on the other side. If they hear you, they will keep quiet. You have sent a message today that indica and the other strains from our jail, depending on how you use it. Let me show you one personal experience. I'm not 72, I'm retired. I have a friend, a close friend, and he had prostate cancer. He had operation, he had steps, he almost died. And 35 years ago, my uncle had covered the water. As a waterman, I always go to the doctor of Michigan and get tests. 4 years ago, that told me because most, and this is what we really disrespectful, most black men are afraid that the finger inspection did it down. So I took it. That said to me, a Jewish doctor, go on, I see something, a biopsy. He advertised radiation or surgery. I said, now, a 70-year-old who on the street doing the radiation. And I left Miami and came home. Every 3 to 6 months, I fly up. 2 years ago, I went up. And the nurse said to me, Dr. Mary is going to manage you. So I got nervous that is a recurrence. The doctor came and told me, good thing, he said, I am losing $10,000 a year because of you. I said, why? He said, what are you doing in Jamaica? I said, that we've only heard 4 or 5 times a day. He said, you don't have to come back. He said, last thing what to do, go over to the other hospital and do the colonoscopy. When I woke up, they said, come next 10 years. Because I smoke. One is why I in Jamaica, because I can burn with her every day. My best friend now is going back into the hospital because of the current. And he won't touch the ganja and come from downtown. So the indica is I just say it volunteer. I don't start to use Viagra yet because of the indica.
So where are the dispensaries? How come there's none in
Yes, give thanks. Well, that was another talk before ganja and prostate cancer. I gave that talk at, I don't know, 2 years ago or something like that. And a lot of indication and a lot of use. So, you know, if you're a male, get tested. But if you get tested, get the ganja and get it from the right doctor, because a top high indication for indica use is prostate cancer.
Okay, one more and then we have our next speaker.
So where are the medical cannabis dispensaries?
The medical marijuana
None in
dispensary.
Westmoreland. I mean, they say up
Speak
north
to
in
that with
OC.
the dispensary and
None in Westmoreland?
So yeah, in Westmoreland there is Doc's Place, which is about 2 miles from here, and in Kingston we have Pure Jamaica, 1 Stanton Terrace, Kingston 6, and then we can give you the addresses. Yeah, just check over the table over there. So yes, you can get medical in Negril and in Kingston.
And they have all the various forms like their
Well, it's not 100 forms like you might see in some dispensary in California, because mostly here we use full spectrum oil and a full spectrum ganja.
Oh, okay.
But it is we have 4 different types that will work on cancer for some and seizures for others. So you have to be examined, get a history, because it's different. As I pointed out, it's not the same ganja for everybody.
In the States, you know, I do pharmacy and medical marijuana, and it's new now. And it's the best thing ever because it has been illegal for so long and so many people have gotten in trouble. And me,
the microphone. Say that again.
but me being a pharmacist, I have seen the big pharma and how they eventually have you walking out with a bag full of chemicals. You know, you want 18 different drugs and, you know, anti-diabetes, hypertension, diabetes, this, that, and other. And I never wanted to have a bag full of drugs. So I smoked marijuana all during my profession. And it was so sad because they wanted to pin you as a criminal. Like you can't be a pharmacist and you want to smoke. That, you know, now that it's legal, it's just such a great thing. And as a result of me smoking, I think I'm not on none of that. You know, thank you very much.
All right, thank you. We're going to get 2 comments here and then we're going to wrap up.
Greetings each and everybody. I greet you through the mighty name of King Savior, the now the highest blessed. The ghost in the gas, Mohammed Sassi, and the Daniel Abakachino, yes, that. While I was reasoning about you administering herbs to different people for different complaints, have I ever placed any emphasis on the type of diet that individual lives on? One, and the reason why I go there, I just want to state this. This is the knowledge that I want, information that I and I as Rasta need for all around to know. Most of I and I as Rasta know this, but the herb is to be approached on a holistic level. See, the way how the herb affects the human structure, it depends on the type of diet. It depends on what you consume. I have lived as a vegetarian for over like 50 years. We have literally become a tree. See, so we now become a plant, and the way we use the plant, we are already one with the plant. That's the difference with I as Rasta. If you know it, the Muslims, if you drink milk and deal with herb are 2 different things. It's gonna mess up. You're a doctor, you're supposed to know that, right? If you drink cow milk, you can't smoke herb, or you drink herb, it's gonna curdle inside, it's gonna cause problems. So a person come to you who has been on synthetic drugs, and you're gonna treat them with marijuana. The first thing, you have to be detox. You have to get that toxins out of your body in order to get the full benefit of the herb. So all I'm saying, we want to put it short, Michael, because I know it's got that speaking in it. But it is imperative that whoever needs and wants and desire to be a part of the plant family like I and I as Rastafarian are, we must approach it on a holistic level. It's not just physical, it's very spiritual. Thank you.
Good time. Yes.
It is a question. Considering what you said before about the percentage of the THC, what comment you could give us on the new strains that they're breeding out of California with 30 and 35% THC and very little CBD?
Okay, thanks. All right.
Bless. So 2 quick questions to answer the brethren on the diet. So we start a diet program with the patients at the same time as we start the cannabis with the patients. So Jadogi can give you some more of his tips and techniques on getting people off of processed food, off of fake food, off of certain bad food. And because many of our patients come in inpatient for about 30 days because the dosages of the THC that we're using go up to 300, sometimes even 500 milligrams per day, depending on the type of cancer. So that person is kind of non-functional. They have to be in an inpatient setting for about 10-15 days for that kind of cannabis treatment. As far so yeah, the diet starts at the same time, because if we go too far with the cannabis and the diet didn't change, it's gonna fail. The cannabis will fail. So as for the second question from Dr. Pottinger, because I can't memorize all the names of every cannabis strain, I'm very stickler on looking at the ratio. So I always want to see the ratio in every cannabis that I get, and I prescribe by the ratio, because especially in Florida, we write the prescription, the patient takes it to a dispensary. They could go to any dispensary. There are like 70 of them, and I don't know who they're going to meet across the counter. So I put in the prescription the specific ratios I want the person to get, and I hope the dispensary gives that back to them. So doesn't matter if they invent some new strain tomorrow with some fancy name that, hula baloo strain, whatever. You just ask them for the ratio and the spec analysis. And the spec analysis, you're looking to see, is there CBN and is there CBG in there as well? Are they putting in terpenes? Because that could affect what's going on. So those very high THC ratio strains were like 1 to 15, 1 to 20, even more than 1 to 12. I'm using those mostly in my cancers, and many times I have to order 2 products for the patient. A high ratio THC product, which I tell them to use mostly in the evening and at night, and then a reverse low THC product for the daytime so they can function and go to work and do the job and drive. So those patients get 2. I have a lot of children with autism. I spoke about that like last year or something like that. And those kids, I have to mix in and get entourage by using 2 products. Low THC product, and then after they use that for like a couple of weeks, then I can bring in another medium high THC product, and the parents mix the 2 together and then use it. So the ratio is everything. Good friend of mine that went to elementary school in Kingston with, he's Dr. Mark Ware. He's at McGill University, and he's published so many articles on ganja. You should read his work. And he's really big on ratios, and he's the one who got me to look at the ratio all the time.
Dr. Hall, thanks a lot. That was a very informative, educational.